If you are over 70, I want you to listen to me very carefully because this might be one of the simplest changes you can make today to protect your circulation, your brain, your heart, and even your energy. You have been told all your life, drink more water, drink 8 glasses a day, stay hydrated, and that advice is not wrong. But as Dr. Drops, who works with older adults every single day, I can tell you this. For many people over 70, drinking only plain water all day long can actually make you feel weaker, more tired, more dizzy, and in some cases, it can even make your circulation worse. The problem is not the water itself. The problem is what is missing from that water. Your body does not just run on water. Your blood flow, your muscles, your heart, and even your brain depend on something else: minerals. And there is one mineral in particular that I want to focus on with you today because most older adults are not getting enough of it, and your circulation pays the price. That mineral is magnesium. Think of magnesium as the relax and flow mineral of your body. It helps your blood vessels relax, it supports healthy circulation, it keeps your muscles from cramping, and it plays a role in how your heart beats and how your nerves communicate. When you are low in magnesium, things get tighter, stiffer, more tense, and with time, you feel it as poor circulation. Now, why am I telling you to stop drinking plain water and start adding a mineral like magnesium? Because here's what happens, and I see this all the time. When you are over 70, your body's thirst signal is not as reliable as it used to be. You often drink less than your body needs, and when you do drink, it is usually plain water. At the same time, your kidneys, your hormones, your muscles, and your digestion are all changing with age. You may be losing more minerals in your urine. You may not absorb magnesium from food as easily as before. Some of the medications you take, especially certain diuretics, acid reflux pills, or medications for blood pressure, can also lower your magnesium levels. So you end up in a very common situation. You're drinking water, but your cells are still thirsty for minerals. Your blood is a little thicker than it should be. Your muscles feel tense. Your legs may cramp at night. You may feel pins and needles in your hands or feet. You may feel cold extremities. You may get dizzy when you stand up. You may have trouble sleeping or feel anxious and restless without knowing why. And then someone says, you just need to drink more water. So you drink more plain water and you still feel the same. Hydration is not only about the amount of water, it's about the balance between water and minerals. You need both. Magnesium is especially important for blood flow because it has a direct effect on the smooth muscles in your blood vessel walls. When you have enough magnesium, these muscles can relax. When they relax, your vessels open a little more. Blood can move more freely. Your tissues receive more oxygen and nutrients. Your heart does not have to pump quite as hard to push blood through narrow, tense vessels. When you do not have enough magnesium, the opposite happens. Those vessels are more likely to stay tight and stiff. Blood flow is more restricted. Your blood pressure may go up. You may feel more tension in your body, more pain, more fatigue. Over time, chronic low magnesium can contribute to a long list of problems affecting your circulation, your heart, your blood sugar, your muscles, and even your mood. So what can you do practically starting today? Instead of drinking only plain water all day, you can begin to add magnesium in gentle, consistent ways. And one of the easiest ways is to add a magnesium source to part of your daily hydration routine, always with your doctor's approval and keeping your kidney and heart health in mind. Let me be very clear here. I am not telling you to pour random powders into your water without thinking. I am not asking you to buy extreme supplements or to follow miracle cures. I am asking you to understand that your body over 70 has different needs, and that water plus minerals is often better than water alone. Imagine this habit as your circulation water. You start your morning not with a big glass of plain water, but with a glass of mineral water or filtered water to which you add a safe, appropriate magnesium supplement recommended by your health professional. You sip it slowly, not all at once. You let that water and magnesium enter your bloodstream gently. Over the day, you continue to drink water, but at least 1 or 2 of those glasses are mineral supporting instead of completely plain. What might you notice over time? Many of my patients report fewer leg cramps at night. They feel their hands and feet are a little warmer. They don't feel as dizzy when standing up. They feel a smoother, more steady energy instead of sudden crashes. Some notice that their sleep improves and that they feel less anxious in the evenings because magnesium also helps calm your nervous system. When you are low in magnesium, your body can feel on edge more easily. Your muscles are tense, your mind races, you feel jumpy or angry or overly worried. By gently supporting your magnesium levels, you're not only helping your blood flow, you're also sending a message to your nervous system. It's okay to calm down, and when your nervous system calms, your blood vessels can relax too. Now, of course, magnesium is only one piece of the puzzle. I always tell my patients, your circulation loves 3 things: movement, minerals, and moderation. Movement. Even gentle walking, a few minutes of marching in place near a chair or light leg exercises while you sit can do wonders for your circulation. When you move your legs, you're helping your veins push blood back up to your heart. Pairing daily movement with your magnesium-rich water is a powerful combination. Minerals. Magnesium is our star today, but you also need a balance of sodium and potassium, especially if you sweat, if you live in a warm climate, or if you're on certain medications. That doesn't mean you should start adding lots of salt to your food. In fact, for many people with high blood pressure, that would be harmful. It means working with your doctor or dietitian to make sure your electrolytes are balanced and your hydration plan fits your unique body. Moderation. Too much of anything, even water, can be a problem. As we age, our kidneys sometimes can't handle large amounts at once. Drinking water slowly across the day is kinder to your body. The same goes for magnesium. More is not better. You want the right amount taken consistently, not giant doses that can upset your stomach or cause diarrhea. If you are listening to this and thinking this sounds complicated, I want to simplify it for you into one very clear message. If you are over 70, stop thinking of hydration as just drink plain water. Start thinking of it as give my blood what it really needs, water plus minerals, especially magnesium, at the right amounts from my body. Talk to your doctor or pharmacist about a gentle magnesium supplement that is safe for you, considering your kidneys and your medications. Ask simple questions. Is magnesium okay for me? What form would you recommend? What dose is safe to start with? Write down the answers. Bring a family member if that helps you remember. Once you have that, build your daily ritual around it. Hydration becomes an act of self-respect, not a chore. Each glass of circulation water is a reminder that you are choosing to support your blood, your brain, and your future. You are not powerless in the face of aging. There are small, intelligent steps you can take, and this is one of them. The next time someone tells you, just drink more water, you'll smile and think, I drink smarter water now. Not extreme, not trendy, not dangerous. Just water upgraded with the mineral that helps your blood move more freely. You deserve a body that feels as supported as possible at every age. Start with your next sip.